Um, Good morning. My name is Dr. No Face. I'll be talking about tuberculosis. I'll be discussing about a range of issues about tuberculosis, about definition, its signs and symptoms, the etiology, transmission, mode of transmission, diagnosis, pathogenesis, and treatment. So, what is tuberculosis? It's simply an infectious disease that's usually caused by Mycobacterium tuberculosis, and the tuberculosis mainly affects the lungs, but also affect other parts of the body. Most infections shows no symptoms, in which case it is known as latent tuberculosis. So these are the symptoms of tuberculosis. As you can see, hmm 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 yeah. Take note that the gastrointestinal symptoms are based extrapulmonary. The extrapulmonary signs and symptoms. Tuberculosis may affect any part of the body, but most commonly occurs in the lungs. Also known as the pulmonary tuberculosis, extrapulmonary tuberculosis occurs when tuberculosis develops outside the lungs. Although they causes together with the pulmonary tuberculosis. So general signs and symptoms include fever, chills, night swells of appetite, and weight loss, fatigue, and significant nail clubbing may also occur. This deformity of the finger or toenail. So pulmonary, the symptoms may include chest pain and a prolonged cough producing sputum. About 25% may not have any symptoms. Occasionally, people may cough up blood in small amounts, and in rare cases, infection may erode into the pulmonary artery, resulting in massive bleeding. Extrapulmonary, this occurs in people with weaker immune system and young children, mainly people that have the HIV infection. They are very prone to it. Notable extrapulmonary infection includes the pleural, central nervous system, lymphatic system, and the scrofula of the lung. There's the inflamed lymph node, and genitourinary system, bone and joints, and bodies of the spleen. What are the main cause of tuberculosis? It's caused by the Mycobacterium tuberculosis, which is a small aerobic non-motile bacillus. Mode of transmission occurs the mode of transmission. The active tuberculosis is, is transmitted by spit, sneeze, speaking, and singing. Any aerobic means of transmission is that interspecies infectious aerosol droplets about 0.5 to 5 micrometers in diameter, and a sneeze can release up to 40,000 droplets. And a share of droplet can may transmit the disease. And risk of infection. People with prolonged, frequent, and close contact with people with the tuberculosis are at very high risk of infection. So risk factor. The people that are more prone to getting this infection are people that have HIV infection. Okay, generally, this HIV infection, when we're looking at it, we're looking at people that have very weakened immune system. Just general people with weakened immune system that are prone to the infection. And these are specific certain medications such as corticosteroid and the infliximab also, and other risk factor: alcohol, smoking, diabetes mellitus, silicosis, and indoor air pollution, drug use, malnutrition, lack of exercise, kidney disease, organ transplant, and head and neck cancer, and genetic susceptibility. Sus- suscep- Susceptibility. And pathogenesis. So the infection begins when the bacteria reaches the alveolar sac, where they invade and replicate within the endosomes of the alveolar macrophages. And these macrophages identify the bacteria as foreign and attempt to eliminate it by phagocytosis. So during the process, the bacteria is developed by macrophage and start tempering the membrane-bound vesicle called the phagosome, and this phagosome then combine with the lysosome to create the phagolysosome. In the phagolysosome, the cell attempts to use the reactive oxygen species and acid to kill the bacterium. However, the Mycobacterium tuberculosis it has a very thick, waxy mycolic acid capsule that protects it from the toxic substance. Mycobacterium tuberculosis is able to reproduce inside the macrophage and will eventually kill the immune cell. And the prevention, vaccines are used of course, the BCG vaccines, and eradication education of people who doesn't have any knowledge about general sanitation and general hygiene. There should be a widespread public uh, rectification on sanitation or create means of prevention with clean indoor environment and outdoor environment. Just a basic sanitary move that could topple or decrease disinfection worldwide. And treatments, well, antibiotics, of course, are used, and antibiotics are used, but the antibiotics are sometimes difficult based on the bacterial characteristics and their composition and structure, which hinder entry of drugs per se, and can cause antibiotic resistance, can cause resistance in that situation. So there's some medication that can be used based on this developing resistance. The rifabutin and the rifampicin are, are not they're beneficial, but it's unclear about the benefit because the use of this dose can cause a bit of prolapse in the patient illness. So latent tuberculosis is treated with isoniazid or rifampicin alone anyway, or combined either with the rifampicin or rifampicin. And treatment takes about 3 to 9 months. It depends on the medication used anyway. When treating a patient with suspected multi-drug resistance tuberculosis, pending the result of laboratory sensitivity testing, patients can be started on the cryptomycin, isonicotinib, hydrazine, rifampicin, ethambutol, and pyrazinamide, and moxifloxacin with cycloserine. So no, do not spit. The practice is very offensive and dangerous. It can lead to widespread of consumption and scatter the germs throughout from person to person, which is very, very dangerous. So I hope you enjoy this short presentation. If you have any, subscribe anyway. If you have any comments or any question that you don't actually understand, and any criticism or critic of what I've done, the comment bar is down. Just comment, subscribe, tell your friends. I'm trying to reach 1,000 subscribers anyway. I'll be discussing more about a lot of range of issue. This based variety content, not generally medical or science content. It's various. I can talk about game. I can talk about biology, maybe. Talk about pulmonology, maybe. Talk about gastroenterology, maybe. Talk about chemistry, if possible. Talk about English, per se. I can talk about a lot of things, really. It's enjoyable for me. Anyway, see you. Have a good day and stay blessed. Bye.